All right, thanks, Kev. And while the calendar has shown it for weeks, a look outside our window is finally showing that winter is ending in New Hampshire, and that means we're in tick season. Unfortunately, the Granite State provides a very fertile habitat for ticks, and to help us prevent tick-borne diseases, joining us today, New Hampshire State epidemiologist Dr. Benjamin Chan. Thank you for joining us today.
My pleasure. Thank you.
All right, so the snow, for the most part, has melted, but again, that brings up some other issues like tick season, doesn't it?
That's right. 'Tis the season for ticks. So ticks have a 2-year life cycle, so they survive the winter underneath the leaves and the leaf litter. And when the snow melts in the spring, they start to come out, they emerge and start looking for a blood meal. Now, most tick-borne diseases peak in the summer months, so July and August. But what the data has shown us is that healthcare visits for tick bites themselves start to increase dramatically beginning in April. So with the snow melting, ticks are out. Now's the time to protect yourself against tick bites.
So what are the best precautions that one can take to prevent these tick-borne delivered diseases?
Yeah, so there's a whole range of different precautions. The best way is to just simply avoid ticks, right? Ticks like to live in brushy, wooded habitat with tall grass. So rule number one, just avoid the tick habitat. If people are going out into these kind of areas, they should be wearing long pants and sleeves to protect their skin. Any exposed skin, we recommend people use an EPA-registered insect repellent that's effective against ticks. Formulations with DEET tend to be very effective and last several hours, but there are other options available. When people come indoors from outside, they should be doing tick checks on their bodies and their children's bodies, and also their pets. Pets and clothing can bring ticks in as well. People can shower within a couple hours after coming in to wash off any loose ticks. And then something people may not think about is that ticks are very susceptible to drying out. So to kill ticks that may be on clothes, we recommend people put dry clothes in the dryer on high heat for 10 minutes. It'll kill the ticks. If clothing is wet, it may take longer drying times.
So what kind of diseases can ticks transmit?
Yeah, so the primary tick of concern in New Hampshire is the black-legged tick, formerly called the deer tick. And the black-legged tick can transmit a whole range of different infections. We hear most about Lyme disease, but there are others. Anaplasmosis, which is a bacterial disease transmitted by ticks. Babesiosis is a blood parasite. And then there are a couple newer emerging diseases like Powassan, which is a virus, and Borrelia miyamotoi, which is a bacterial disease that's newly emerging in our area. Many of these are treatable, easily treatable with antibiotics, but some of them, like Powassan, don't have any available treatments. The best way to prevent disease is to prevent tick bites.
Now, lastly, you did mention that folks, before they enter their home, check themselves, check their children, check their animals. If they do find a tick, what should they do?
So remove it right away. The best way to remove a tick that is biting someone is to grasp as close to the head of the tick as possible, as close to the skin, and then pull gently and smoothly until the tick comes out. Tick spoons are also, good ideas. People should not compress the body of the tick. They shouldn't light the tick on fire. They shouldn't put stuff over the tick. That can cause the tick to regurgitate and actually increase the risk of infection. So just grabbing as close to the skin as possible and pulling gently is the best way. Then wash the area with soap and water and be on the lookout for signs and symptoms. If someone finds an engorged tick or they think the tick has been there for more than 36 hours, they should call their healthcare provider because there is an antibiotic that can be prescribed to prevent Lyme disease specifically. There are not antibiotic prevention methods for other diseases, but there is for Lyme disease, and people should be in contact with their healthcare providers.
All right, Dr. Chan, thank you for all that great information.